Rosalind, can you talk about your background? How did you get involved into psychedelic research?
Yes. I started working in the psychedelic field as an assistant guide in a psilocybin for depression trial. So I was there as a volunteer for the first year or so, and then I did some qualitative research with the participants of the trial looking at how psilocybin had helped them, what had changed. And then from that research I deepened my role and then joined full-time and became a researcher and ran a clinical trial. And then now I'm working on integration processes and practices in a community framework.
That answers my question professionally, but why are psychedelics interesting for you as a person?
Well, it really was from observing my best friend. My best friend from childhood had quite bad depression when we were teenagers, and when she went to university, she left university, she was in a really, really dark place. And she went to have an ayahuasca ceremony in Peru. And at the time I was very, what are you doing? You know, it was like 12 years ago or something. You know, it was like, well, no longer than that, it was ages ago. It was a few years after university, but yeah, like 15 years ago. And she was very, very sure that it was going to help her. And I was very sure that it was extremely dangerous. And then she came back and I saw the difference it had made. And in the back of my mind then I knew that this was something that could really help. And then it was only when I went on maternity leave with my daughter 10 years ago, that I actually had time to research it. And it was from doing the research that I was like, aha, it was very much from a professional place of this is the way I want to work. Personally, I feel like my hope for psychedelics mostly comes from observing how it can help other people. For me, I would say nature practice, being in nature is my psychedelic. So for me, kind of gentler things, I think are more conducive with what works for me. But I'm seeing amazing shifts with other people.
You were involved in clinical trials on psychedelics as a facilitator. How was that experience for you?
I would say it was wonderful, inspiring, moving work. Long days, tiring days sometimes, but really magical and wonderful. And very tough as well, requiring all of you, requiring your full heart. And sometimes not really knowing how to respond to things. It's hard to train for every eventuality that comes up. In many ways you just need to be able to be present and respond in a way that is grounded and ethical. And sometimes when there's a lot going on in a session and you don't know whether to respond or to hold back, you need to have a strong kind of inner voice of like holding you steady. And you also need a lot of support. You need to be able to unwind in the evenings. You need to not do too many sessions, otherwise you can burn out. And really, really recognize what a big thing it is to be there present with people, especially if you're, in indigenous settings where there's a whole cultural group around it and setting around it. They're supported by each other. But as lone or duo therapists, there's not much of a support structure around you. So it's like who holds the people that hold, we find that. Again, it's about finding your allies. It's all about finding the group. When you have your village around you, when you're part of a collective, you're part of a group, you can work together, you can support each other, you can elevate each other's voices. When you form your own little community, then everything is easier. Whether it's the guiding work, whether it's the academic work, it's all easier when you have your community. And you have to sometimes really work to nurture that little community. When you don't have it and you feel isolated, then the struggles of the guiding work or the research work, you can feel lonely underneath the uphill climb. So finding your community.
Randomized controlled trials are still the gold standard for clinical research, but they have their limitations when it comes to psychedelics. How do you see those limitations?
Trying to fit psychedelics into the kind of medical model world, into drugs trials is in a way trying to fit a circle into a square-shaped hole anyway. I mean, there were so many things about it that didn't quite fit, but I think it still gave us important information. I mean, there were many criticisms of, the blinding people, the big issue around how well blinded psychedelic trials are. The people in the placebo condition kind of know they are. But actually in our placebo condition, a lot of people, because they had a very small dose of psilocybin, felt like they had experiences because of the way we set it up, and we did guided imagery, and in the sessions they had all the music and the guides, so people still had quite rich experiences. So I would say that our trial felt like the blinding was actually much better than people might have imagined, and that some people in the high dose psilocybin group didn't really have much of an experience at all. So there was more, it was quite well blinded in a way. But I do wonder whether the medical model approach, in a way, it makes sense that this is the way that we've chosen, this is the way that we're trying to bring psychedelics into the culture of the people that need them and can use them safely. But I do wonder whether maybe using the resources and the focus and the energy of the community to look at decriminalization and creating really strong, robust grassroots containers at the community level with good training and good regulatory systems for community structures. I mean, we don't really have that in our culture now, but we'd have to build it. But that using that rather than going down the kind of medical corporate drug development route, I do wonder whether that might have been more sensible. There's so much money focused on drug development, but a lot of the focus of the psychedelic industry is on drug development. And from where I'm sitting, I think we have wonderful mushrooms that grow in the ground, and we have wonderful vines that grow, and we have already like a whole host of different psychedelics that have been very well researched and we know are very effective. Do we really need to keep researching more and more different patented versions of the same drugs? Or should we be focusing our resources on saying, we have these tools, we know they work, how can we just decriminalize them instead of keeping them legal and going through the medical route? How can we decriminalize and really focus our energy and time on saying, we have them, let's use them, let's make them safe, let's think of really good safeguarding structures in our communities. I think that, in hindsight, I think that might have been wise. However, the problem with that is that for people who are really suffering from depression, for them, they want the trust of going to a hospital, being with a doctor, being with psychologists. For them, I feel like they really deserve that medical approach. It's just that the two models don't seem to be working that well side by side.
When you are on psychedelics, there are many difficult, challenging experiences. So how can we deal with those experiences?
I suppose be honest with people that psychedelic treatments are incredibly, it's a kind of it's a high risk sport. It's a very intense, like using analogies to help people understand that it's kind of more like a skydive or a deep sea dive or a emotional roller coaster, rather than the brain reset analogies, which I think make people think it's like a passive thing. You go in, you get your brain reset, you come out. And in fact, it's such an engaged process a lot of the time. So I think being really clear about what psychedelic experiences can be like with people and avoiding the temptation to package them neatly to make them more appealing. So being really honest with people about what they're like, and then having just really good training for therapists so that they're really able to support well. And then my biggest passion is around community integration, because so often with adverse events, they arise months afterwards. So they don't really sometimes come up in the session or like just afterwards, but people usually have a bit of an afterglow. It's usually a few months later that the issues that may have come up, psychological issues that may have come up in those difficult experiences, tend to resurface, and then they're left without any care. So it's how can we build community structures of integration and support so that people aren't left alone, aren't kind of abandoned after these experiences, so that if difficult stuff comes up again, they're supported to process it. I think a difficult experience in the moment is one thing, and obviously research has looked at those challenging experiences, but difficult integration is also very common and less well researched or understood, like the ongoing challenges after those difficult experiences.
You founded a group that helps people to integrate psychedelic experiences. Can you talk about that?
Yes, thank you for the question. So it's called Accept, Connect, Embody, Restore. And it's an integration community. It's an online community. The best way of describing it really is kind of like, it's like a 12-step online year-long process. It's a framework and a community container online for people. And instead of the 12 steps, we have 12 trees. So every month has a different theme. And every theme is around developing connectedness to self, other people, and the world around you. So rather than like AA, which is a 12-step program for achieving and maintaining sobriety, it's a 12-step program for achieving and maintaining connectedness to self, others, and the world. And we developed it this way because my research showed that connectedness to self, others, and the world was a really important mechanism in psychedelic therapy. So we wanted to create a way that people could maintain that afterwards. And so they make good friendships, they have people to talk to, they have lots of different kinds of meditations, breath work. We do all sorts of different things together, but it's a really lovely bonded community of lovely, lovely people. It's a really nice place to go. You know, it's like a virtual world. You have to call it our like forest. It's a place of gentleness.
One of the key words you use is connectedness. Is there any way to assess and measure how connected people are?
There is, yes. There is a scale. You asked me before about my experiences in academia, and that was one of the reasons why the scale, instead of being called the Imperial Connectedness Scale, is called the Watts Connectedness Scale. I thought imperial connectedness, just what the word imperial means, the connotations, imperial connectedness didn't sound quite right. And I also really wanted to make sure that my passion and my research stayed close to me rather than being kind of taken somewhere else. So I called it after myself. So it's the Watts Connectedness Scale, and it has 19 items, 3 domains: connection to self, connection to others, and connection to world. And yeah, it's a 19-item measure that anyone can use to measure their connectedness. It's great to use it before and after psychedelic therapy, or just other interventions as well.
So connectedness is more like a spectrum than just a binary, right? That either you are connected or not.
Well, yeah, so what we found in the validation of the measure, which was done by a team, Imperial, Hannes Kettner and Laura Kartner, they did a factor analysis on the WCS used with a big sample of people using psychedelics, and they found that connection to self, connectedness to others, connectedness to world, those 3 domains were distinct but related, and that when people's connectedness improved with psychedelics, they tended to go up across all 3 domains. So when people open up and connect, like really connect, they tend to connect to self and others and the world. And when we saw people kind of close down again afterwards, after the psychedelic trial, the depression trial, I kind of observed how people would close down to themselves and others and the world around them. So I think that has important implications for humanity, really.
Since the first bicycle trip of Albert Hoffman, we know that connectedness to nature is also very important. Can you elaborate on that?
One of the most common insights that people have with psychedelics is that everything is interconnected, that they're part of a living web of life. And it can be an incredible insight, really transformational for people to realize that they're not separate, they're not a walking ego, an ego on a stick, they are part of a web of life. Psychedelics can really help us realize that and realize that we are nature. So when people talk about connecting to nature under psychedelics, it's not so much, oh, I really like nature now as a thing, it's I am nature. And that has much bigger implications than just something new to love, because people often weren't particularly connected to nature before, in my experience. We've grown up with shopping and computer games and all sorts of other things rather than deep nature stewardship. Like, we often haven't grown up understanding our land and tending to our land and playing, as children, like there's a lot more kind of indoor activities. So in our culture anyway. So I think it's not just about having a new hobby, it's about discovering a new part of yourself and going from being an ego self to an ecological self, where you are intimately linked with the world around you and more motivated to want to protect it. So I think that there is often in the afterglow of a psychedelic experience, this sense of real commitment to wanting to look after Mother Earth, and then that often fades, which is why in our community we really try and help people stay connected to the wisdom of the trees. And people often really, they don't just connect to nature, they fall in love with trees, and trees become their friends, and they want to plant them, and they want to take care of them, and they want to spend time with them. And that is, life-changing for many of us.
Sometimes in this field, the line between spirituality and science is very blurry. How can we draw this line, or should we draw this line?
Yeah, I mean, I think it's one of the kind of challenges with the RCT model. I suppose really as long as we're non-directive with people as therapists, as long as people are allowed to just have their own experience, then whatever experience they have is their own. And as long as our own opinions don't guide someone in a particular direction, then I think in the connectedness scale, one of the items was about connecting to a spiritual principle. And that came out of the research showing that lots of people did connect to spirituality. But that was from them, not imposed by us. And I would never give people spiritual books or suggest that they might have a spiritual experience, but more just listen to, if that happens, listen to that like you'd listen to anything else. So in that way, just keeping an open space.
Being under the influence of psychedelics is a very vulnerable position. We hear stories about sexual abuse. What can we do to mitigate those risks?
Yeah, it's a very, very important question. I think you can kind of think of it on so many different levels. I think in our culture generally we have with the Me Too movement, a realization of a long history of mistreatment of women, and a culture that is started to really wake up to that and see and understand. And that happens across all different fields. I think in the psychedelic field, where participants are vulnerable because they've consumed a substance that makes them vulnerable and kind of suggestible, and boundary violations are particularly concerning because they can be particularly harmful. People are, in that more kind of vulnerable state, there's a lot more potential for harm and confusion. So I think what we can do as a community is just provide spaces for people to really, we can increase our survivor literacy so that there are places that really understand that when somebody describes being harmed, that we have a support network for those people. And not just thinking about supporting the person that has suffered harm, but also supporting the person that has perpetrated harm, in the sense of thinking about how transformative justice, where we say there has been a rupture, how can we call people in and how can we bring some accountability and some support to this whole situation so that the person who has been hurt is heard and supported, but that also the person that has done it is also helped to atone and to learn and to stay with it, rather than just what often happens is that they just go somewhere else. And so if you remove people from the community or just say, you did something bad, go, they just go somewhere else and do it to somebody else. So it's how can we, if psychedelics are about, transformation, and we really want to do this well, how can we be pioneers in the field of repair and supporting people who have been harmed to thrive again, to be restored to how they were before the harm happened, and to bring forgiveness and understanding to the perpetrators and bring the transformation possibility for them as well. I think it's asking a lot of everyone to try and do that. But I really believe that we can, because we have these tools that help us forgive and process. But we just need the structures, and we just need the forums for discussion. So we've been having these online gatherings to talk about difficult issues, and we do it with all of our facilitators from the ASA community, and we have these speakers talking about difficult topics. So we had an event recently called Love and Grief in the Shadow of Psychedelic Narcissism, and We had people come that had suffered harms and people come that were just interested to learn more. And we had this lovely gathering where we'd all just listened to each other, heard the speakers, and did a tree meditation at the end to try and come together as a community to make the space for repair.
We see many patients desperately waiting for access to treatment, but on the other hand, we see people saying that we are moving too fast and we need to ensure evidence-based and ethical standards. How can we find the balance?
Great question. I see all of it, really. For people with depression who are desperately waiting for this to become an available treatment, you know, it's a life-saving thing for many people. And yeah, they make sense that they would absolutely want us to move as quickly as we possibly can. But I think if we move forward before we're really ready and before we really understand, it's like slight shifts in the way in our path now, further down the road, lead to very different outcomes. So I think it's about having time to really review and look at the bigger picture of the whole community, and look at the adverse events, look at the long-term outcomes that often get ignored by the research. What's happening? What are the issues? What's the shadow? And really keep that kind of community focus so that before we go too fast down a road we're gonna have to course correct later, like really staying with the bigger picture now. I think for that, what would have been helpful looking back is elders. If we'd had a kind of, thinking about the indigenous way, like the elders, the wise ones, the ones that have lived through it all and with lots of experience, if we'd had a kind of, in the community, some kind of circle of really respected elders, really wise, not looking to make their own name, not looking to climb the career ladder, just really invested in making this as safe as possible and as accessible to as many people in a good way and in balance with the ecosystem. If we'd had that, maybe we could have maintained that kind of like focus around the whole ecosystem. But as we haven't, I think we will be a bit more stoppy-starty, go back, go left, go right, because we're always kind of course correcting and we'll find our way, but we're finding our way as kind of kids rather than as mentored. We haven't got the eldership, and that's just because in our culture, when we've got some amazing people like Bob Jesse, Bill Richards that I was talking with yesterday, and they're amazing, wonderful elders, but we haven't really had the structures to bring those and other elders with other perspectives together. And I've really missed that. I've really longed for that. So I think without that, if I had to say like whether it's moving too fast or too slowly, I would say I couldn't really answer that. I would just say that when we're all together, we can move much faster when we're working as one, rather than it's a bit more fragmented